in the case that I learned, I think especially it was essential to take drugs correctly to maintain the organ function. To do this, pharmacists need to encourage the patient to understand the importance of medication management. So I introduced the two ways of improving the medication adherence of the patient. First, using of drug instruction. This is a drug instruction I created for the patient. It describes the side effects of drugs and infection prevention method and diet precaution and so on.
It's nice to like the form you made for drug instructions. It's very clear because the pamphlet of the drug, which comes with the drug, may be vague or not easy to read by the patient. So it's important for the pharmacist to highlight the main points.
And what is the important points on making introduction?
This patient need to care, especially the infection. And so I emphasize that information. Also, I emphasize about diet because she didn't know that she can't eat. So, for example, raw fish is not good for her, but she didn't know that.
She didn't know what kind of food she should eat and what kind of food she should avoid.
Yes, thank you, Nahara-sensei.
It's called food interaction.
Food interaction?
Yes, we have drug interaction.
Mm-hmm.
This is that if you are taking two drugs together. And there is a food interaction. Some kind of food and fruits, they can cause exaggerated or increased side effects or unexpected side effects with some drugs. Grapefruit is a very famous example to have some food interactions.
First, pharmacists check the regimen of chemotherapy. We need to verify the dosage and supportive therapy the doctor submitted. The dosage of S1 is decided by the body surface area. According to her area, it was 120 milligrams per day, but her creatinine clearance was not so good. So considering about these things, the dosage of S1 was 100 milligrams per day, and we checked it was correct. So through the practical training, I would like to know about the roles of Canadian pharmacists. And I also want to know how pharmacists communicating with children and their families.
You mentioned you want to know how to communicate with the children and their families.
Yes.
Of course, the special about pediatrics is that they don't complain, they just cry. So it's very difficult to know why this child is crying. So the communication with the mother and parents, you should ask guided questions because maybe they don't, the parents themselves, even they don't know what is the meaning of this action.
In your practical training, when you communicate with the patient, what is your point to communicate with the patient?
Important thing, I think, is the to know the patient's baseline of symptoms. For example, in your case, patients have constipation by the chemotherapy, but some people always have constipation in their daily life. So it depends on those situations. We have to check the how severe of the symptoms for them.
This is called the bowel habit.
Bowel habit.
Bowel, yeah, bowel is the intestine. Every person has a different bowel habit. Habit means it's usual, is usual, okay? So some people, they always have constipation because they are drinking a lot of coffee or they don't drink a lot of water. So this is a bowel habit. Usually he goes to the toilet for defecation like once per day or once every 2 days because he is a heavy smoker, for example. Okay, so all these habits can cause a natural constipation for the patient. So that's a very good observation you said. We should know the bowel habit.